The water situation at Kalafong Hospital in Atteridgeville, west of Pretoria, has normalised. However, provincial officials say they're keeping a watchful eye. The health facility has had a water shortage over the past few days. The reservoir, which supplies it, was depleted after Rand Water implemented water restrictions. Provincial officials indicated that the City of Tshwane has provided tankers to provide the hospital with water. Now, let's discuss this. We're now joined via Zoom by Democratic Nursing Organization of South Africa, DENOSA'S Gauteng Chairperson Simphiwe Gada. Simphiwe, thank you so much, sir, for your time this afternoon. Now, we know, of course, that Helen Joseph as well as Rahima Musa hospitals also have been battling with dry taps. But let's discuss the situation in Kalafong. I'm sure you've been going around the hospitals. I'm sure you've been keeping an eye on what is happening. If it's not electricity, it's water. Talk to us about the latest in some of where your members are based in these hospitals.
Well, thank you for inviting us and good afternoon to the viewers. Well, indeed, we have had a lot of challenges. One over the weekend in Kalafong Hospital. Today we have also checked, we're informed that, the situation somehow has normalized. But for us, we're not comfortable with the fact that we're told that the situation has normalized because, one, we have not yet really established as to is the problem with the municipality, is the problem with rainwater, or is the problem with the reservoir. So we need to clearly diagnose what is the problem so that we can be able to have a permanent solution. Then we can comfortably say that the situation is normalized because we have been having all these challenges, as you have rightly indicated in your intro. In Helen Joseph as well as Rahima Musa, we know that part of the problem has been partially blamed on the issue of load shedding in that rainwater has been unable to pump enough water that would run, to people's taps and so forth. So these are the challenges that we continue to grapple with in the midst of the load shedding crisis. But also the other problem that we continue to grapple with is that in some instances, as load shedding happens, we find that we are battling to have our generators kick in because of non-availability of diesel in some instances. Now, I know that the Minister of Health organized a press briefing where he was briefing that certain hospitals would be exempted from load shedding. And unfortunately, we must inform South Africans that that has not been the case because right now what we know is that there's a debate going on now between the Department of Health as well as Eskom as to who must buy the cables to redirect electricity and take off these hospitals from the grid that is affected by load shedding. So the problems are many, it's a challenge that we're having in our healthcare system. And unfortunately, much as there's accessibility in our health system, but we cannot confidently say that that accessibility goes hand in hand with people getting quality healthcare services in our facilities, mainly because of these disturbances that are occurring.
And I was going to then ask, how are healthcare workers coping? Because I would imagine they're also concerned about the measles outbreak that we also know is in Gauteng as well. And there's also COVID-19, which makes it imperative for healthcare workers, to be extra cautious and use water as well as they are dealing with, the ill that come to hospitals to get better.
Well, without even concentrating on the measles outbreak as well as the COVID-19, it is standard protocol that in a hospital, you should maintain the highest level of cleanliness. You must maintain the highest level and try and mitigate against any form of infection, thereby always washing your hands in between patients, always washing your hands before performing any medical procedure, and avoiding at all costs what we call nosocomial infections, which is the hospital-acquired infections. Because in some cases, a patient would arrive with a particular complaint in a hospital. While we're addressing that one, you'll find that a patient then gets what we call the nosocomial infection, which they catch inside the hospital. So the risk for that, without going into COVID and other and measles is there. You know that if people are taking medication, even the staff themselves, they have to relieve themselves. It's difficult. Now, nurses and all other dedicated healthcare workers, especially nurses, because they are the ones who sit with patients in the wards, they find themselves carrying buckets of water, going to get water so that patients can be able to use the ablution facilities, so that patients can be able to bath and so forth. So these are the nurses that go an extra mile. Now, if we didn't have dedicated nurses, it would be a disaster, because a nurse can simply say that it is not my duty to ensure that there's water in the hospital, and I will stick to my scope of practice. But we have nurses that understand these challenges, who continue to go beyond the call of duty, beyond what the scope of practice is prescribing. Now, with the measles as well as the COVID threats that we have, it gets worse, and most of the time, people must rely now on the sanitizers, to be able to mitigate against any form of infection, because it becomes difficult really if without water. I mean, children are normally sent home when there's no water. You can imagine hospitals don't have the option of closing your hospital because there's no water and so forth. Unfortunately, we must then make plan B. But we must condemn this thing, Unati, to say that, for some, it is an opportunity for looting, because as and when this water comes, it is priced at exorbitant prices. And this is a message that DENOSA is consistently saying, that we are against any form of looting in the midst of any crisis. The government has got to pull up its socks and fix these issues.
Now, you say that, nurses go beyond the call of duty. Do you see that in our leadership? I mean, you mentioned several things that could be done from a long-term basis, having hospitals get off the grid. But yet again, we have water shortages in the hospital. Do you think the kind of leadership that we're seeing today could dramatically improve the situation?
Well, we see that there's a will, but if all of them were pulling towards one direction, then we could say that they have that. But at the same time, the question that you are asking is a question that requires a broad issues that we must look at, because you and me know that post-1994, for instance, in 1999, Gauteng had about 7.5 million people. Now, only many times we always collect the census, always collect the population information, and that information is meant for government to be able to plan. But in this instance, we ask ourselves, why do they keep doing census? Today, we've got more than 15 million people in Gauteng. But if we were to go around and audit how many hospitals have been built by this government, I would want to argue that there's no hospital that has been built. They would want to say they've built Natal Straight Hospital, which is now Telemokherane, and I want to argue that they closed the old hospital because they opened that one, which also came with its own problems. There's Begimlangen. So without the two in a province that is highly densely populated, there's absolutely no excuse why we don't have extra facilities, why we do not have better ablution facilities, why we do not have hospitals being connected off the grid, because load shedding did not start today. They knew the problem a long time ago. They should have anticipated and planned better that these hospitals must be taken off. Now, we're expected to clap hands for people who go and convene press conferences and announce that they've applied to ESCOM to take hospitals off the grid. We're not going to clap hands for that, because the very same challenges that they are addressing is challenges that they themselves have created. They themselves are sitting in a better position to mitigate against them. So we'll never clap hands for such mediocrity. To us, that is mediocrity, because the problems that we are sitting with is not that government did not have the available data on hand. I mean, they know that the population was growing. They know what happens in our borders. So they know that the health demand has actually increased. So they should plan better. They had a lekgotla this past weekend, but nobody is talking about the challenges that go beyond electricity, the issue of water. Now, these are things that do not, in our view, require a state of emergency, as we are told that they are looking at the legal meaning of a state of emergency on energy. We don't believe that, because for us, that is another opportunity for looting. Because under COVID, we're under a state of emergency and people looted, because what basically happens under a state of emergency is that certain rules are relaxed because we need to procure things at a faster rate, and some people see a window of opportunity to loot the resources of this country, and this is what is a threat to our democracy, the issue of healthcare services, the issue of corruption. So we cannot completely say that we are confident that the leadership is going to address these issues. We'll see as and when they do them, because we've been listening to a talk show, but we want to see tangible action now.
Simphiwe, thank you so much for your time this afternoon. DENOSA'S Gauteng Chairperson there, Simphiwe Gada, saying, of course, it's time for action in terms of the electricity and now the water crisis that we're experiencing.